Greetings. I'm Dwight Harken, and I'm delighted to have this opportunity to tell you about Mended Hearts and its great development. Back in 1951, when heart surgery carried an overriding fear of dying, 4 of my post-operative patients were sitting in a lounge at the famed Peter Bent Brigham Hospital, now Harvard's Brigham and Women's Hospital, and they were exclaiming over the joy of survival, the joy of being alive. And they talked to each other about how wonderful it would be to have an opportunity, or have been for them, had they had an opportunity to have somebody come and visit them and show them living proof that heart surgery could be successful and one could be happy and well after surgery.
I'm tremendously privileged to be a participant in the whole cardiac surgical kinds of programs, starting before my life when my dad started doing it. And he recognized the value of a patient who had heart disease and then had a therapy for that, to go back with the understanding of what that process was and communicate to potential patients who were thinking about proceeding with some kind of aggressive cardiac therapy. And that's always frightening. And patients, we all recognize that your heart's an important organ in your body. And when you have something wrong with it, the idea of having it fixed can be frightening. And so the beauty of the Mended Hearts is that they have gone through this frightening process, and they, with a realistic understanding of what that process is personally, can communicate that to a prospective patient in a way that simply can't be accomplished by a nurse or a pharmacist or a surgeon or a cardiologist. It's just so much more meaningful. You speak the patient's language. And then the beauty of this is that you then begin to realize what a gift you've got. you can communicate, you can make somebody else's anxieties just melt away. You can improve the process, and a patient who believes in their therapy simply does better. I was fortunate to be able to practice cardiac surgery for almost 50 years, and there's no question that patients who understood what was happening and could participate both physically, biologically, and psychologically in the process did better. Then the mended heart could communicate that both pre-operatively, intraoperatively to the patient, and post-operatively. The mended heart was a major communicator, translator in that constructive, very constructive process. The secondary advantage accrues to the patient who is now helping other people. I was mentioning to Jody Smith earlier that David Brooks wrote a book called The Second Mountain. And the first mountain, he argues, what you do is you build your own pedigree. You go to school, you try and make yourself a more constructive participant in society, and you learn how to live in society personally and selfishly. Then some people recognize that the most gratifying, rewarding, exuberantly happy thing you can do is to help somebody else. And this is what the Mended Hearts know. This is what the Mended Hearts do. And so the Mended Hearts are capable of communicating to patients what the process is going to be, and then showing them the outcome. And there's nothing more gratifying, but also realistic and capable of communicating. I can tell you how I feel if I had an operation, but it's so much more persuasive if I show you how I feel. And so the Mended Hearts have been able to accomplish that. And the wonderful thing is that not only are you helping the patient, you're helping the family, you're helping the surgical team, but you're helping yourself. You're giving yourself the opportunity to help others, which has got to be the most gratifying thing you can ever accomplish. What you're doing is making other people much more comfortable. By doing some, whether you recognize it or not, you're also fulfilling your own destiny, your own participation in life's progress. We see a lot of people who seem to have a lot of material benefits who aren't happy. Mended Hearts are always happy because they're doing something that's valuable, rewarding, but by helping others, they're making their own lives valid. And that's tremendously important. That's the message that I would send to Mended Hearts, because I've watched it happen. I actually was privileged as a little boy to watch it when I didn't understand what was happening at its inception. But then I was also privileged to become a cardiac surgeon, and with almost 50 years of practice, I watched Mended Hearts participate in the entire process, both before an operation or therapy, and then afterwards. And by communicating what the options were and the process was, the psychological stresses of initially recognizing that you've got a cardiac problem, then going through the tremendously confusing various alternatives and options, then undergoing the therapy and then recuperating and recovering from it can be tremendously complex. And to have somebody psychologically holding your hand during that process and helping you understand what the complexities are, what the options are, and what the likelihood of success is extraordinarily helpful to everybody, to the patient, to the nurses, to the surgical team, to the families. And patients who, in my view, have a mended heart as a companion during the process simply do better.